A well-defined jawline plays a key role in the aesthetic appeal of faces in both males and females. Dermal fillers offer a minimally invasive, short to medium term approach for treating mild to moderate diminishing of the mandibular bone, as well as for the elevation of slight sagging or jowls. So let's start with marking the masseter muscle. This is the posterior border, and the triangle here is where we're going to be injecting the filler. Any filler placed on the masseter muscle will make the face appear wider from the front. Labiomandibular fold and the triangle of the chin that we need to fill up. This triangle also helps improve the profile, and once again the triangle in the back where the jawline filler would be placed. So let's start the treatment. Entry point in the direction posteriorly towards the ear. It's not placed too deep because we're only going to the superficial layer, superficial fat layer. Generally speaking, you can inject filler in two places. One is in the subcutaneous space and one is on the periosteum. For that you should get a needle and go down. However, we are teaching you how to use the cannula here, and this is a much safer and simpler injection for very mild to moderate jowl lifts. If the case is a bit more complicated and requires more filler, then I tend to go on the bone. However, majority of my cases are treated just with using the cannula in a very simple 1-point entry, and the difficult part is sometimes getting the cannula in the hole. Once passed, you will encounter some mesenteric cutaneous ligaments, and you have to, well, this was quite easy, but you sometimes have to tunnel around them. And first point we're going to is the angle of the jaw and depositing bolus there. Change the angle, go up 25 degrees and go as far up as close to the ear as you can. Remember, you have to avoid injecting the masseter on top of the masseter. And sometimes you really have to push the cannula, make sure you feel the tip where it is to confirm that it is behind the line we drew there for the posterior border of the masseter. After that, massage using the gauze, because gauze applies good even pressure, and just keep massaging it for a while, and then by now you should have injected a good 1/3 to 1/2 of the filler. You'll probably have done a bit less than that when you're first starting off, but as you get experience, you put a 1/4 of the filler in each injection. And some other divots that I saw could be improved a bit, and that is to camouflage the jawline. So after massaging, sit the client up and have a visual inspection to see what happened. And in this case, you can see the angle of the jaw looks much sharper, and the jowl actually has lifted up quite a bit. There's very little shadowing occurring in the lateral wall of the chin anterior to the labiomandibular fold already, because of the fact that the jowls have been lifted up. It is good practice at this time to show to the clients in a mirror the progress of what a little bit of filler has achieved there. I've noticed from experience that when I show clients step by step of what I'm doing and what it's achieving, the overall satisfaction is much higher. But keep in mind, this procedure will take you 30-40 minutes to do in the beginning, and that's a lot of time for the client to wonder what's happening and if things are going right or wrong, and every few minutes showing them after you made some progress. And then you can ask them a direct question: do you see the difference? If they say yes, good, job done. If they say no, then you just say, well, we just started on this area, we can add some more. The aim is just to get the client involved and reassure them a bit and decrease their anxiety of what's happening. Now, the lateral wall of the chin has been nicely filled up. Trying to use the cannula to go towards the chin itself, but once again, it's hard to get the cannula into the hole. I see. Good, and then flip. Remember, you can't flip the cannula while it's inside too much, so you literally have to put the tip of the cannula under the dermis and then flip it. You can slide it and you will encounter a lot of ligaments here. And just a bit on this side. Actually, this was done because her chin was a bit asymmetric and this side was a bit higher than the other, so that's why this was kind of done. So we're adding some more to this side, because this was the jowls were heavier on this side, indicating more fat loss in the outer temporal fat pad, which is the fat pad in front of the ear. We are trying to fill out one part of it, the posterior part of the fat pad. Now remember, the fat pad, you know, starts around where the tip of the cannula now is, but it goes all the way over the masseter muscle. We're not trying to get that component. Usually the masseter hypertrophy in a lot of people compensates for the loss of the fat in that compartment. Now, massaging is very important, and the jawline is coming along really, really nicely here. Let's have a look what we've done. And you know, it looks good, but for some reason it doesn't look lifted enough. However, when you turn her face to the right, you see a beautiful jaw angle, good jawline, and something where the chin meets the jawline along the labiomandibular fold. There's a gap there which is interrupting the jawline, and that bit needs to be filled up to make the jawline continuous all the way into the chin. Now, some in there. Okay, going back in there. Remember, you can go further than the length of the cannula by pushing the skin in a fold like that. So sometimes you miscalculate the hole, and that technique is quite useful to know that you can push and gain a bit more distance. So this is the important area right here, starting with this around here and filling up the jawline. So let's start with the other side, same thing. Well, over here we'll start with the labiomandibular fold region first, and trying to blend the chin to the jawline a bit better here. Once again, getting the cannula in the hole is the biggest trick here. And once you filled up this triangle, then you want to flip and go towards the chin a little bit, and then where you've entered you have to do like a 180 degree and fill this region up a bit. When you fill this up with a decent amount of filler, like a quarter of a mil, 0.2, 0.3 mil, it does then connect the chin to the jawline, and the chin looks just much better when it's connected to the jawline. The subcutaneous space should be your favorite place to be, and especially with the advent of the cannula. You're not worried about damaging neurovascular structures unless the cannula is very, very thin bored, but wide bore cannulas, no. And you can really focus on contouring the skin here as you wish, where there's, there's a lot of visual parameters you have to follow. Where there's less volume, you add more volume, and the results are so satisfying, simply because you know what you've done is prevented a facelift or even a consideration of a facelift. A lot of doctors online are talking about not pulling fillers in the jawline, and I'm not sure exactly where they're coming from. We have not encountered such problems. We probably select our clients better. We treat mild to moderate jowls and not heavy faces. Mostly the clients we treat are slim, long faces. She's a bit medium size, medium face, and that's still appropriate enough to provide a good result. As you can see, very little shadowing around the chin area, especially this side. Treated a bit better. Good jaw angle.